Welcome back to Healthy Living. We're back to talk about our topic, summer safety, and my next guest is Nicole Melerine. She works in our trauma department at St. Tammany Health System. She is the Process Improvement Coordinator for Quality and Accreditation, and she's also an RN. So welcome, Nicole.
Hi, thank you for having me.
You're welcome. I'm glad you could be here. So summer safety, I mean, we are some active folks in Louisiana in the summer, right?
Very much so.
So we want to talk about that. First, I want you, though, to tell people what you do with the trauma department and what the trauma department does. Tell us a little bit about you, and then tell us about the trauma department.
I'm an RN, and I have a lot of surgical, post-op surgical experience and trauma nursing experience with critical care, so the recovery of the trauma patient. And that's what, that's what was my goal, was to take better care of the trauma patient. So the position as a trauma performance improvement coordinator is to really help manage all the multidisciplinary processes and the quality outcomes for the patients at St. Tammany.
Okay.
So being a level 3 trauma center means that we have 24/7 specialty care provided to the patients, and our emergency physicians are ATLS certified.
Okay. What is ATLS?
So it's the
American
Trauma Life Support.
Okay.
Yes, sorry.
Perfect.
And then most of our nurses are also TNCC certified, which is Trauma Nursing Certification.
Wonderful.
So that means that they are educated and certified in a process where they are more knowledgeable about providing prompt response to care for those traumatic injuries that patients may receive.
Okay.
Yeah.
Okay. So that is important information to know, especially when you're choosing where to go for your care.
Yes, ma'am.
Right, in an emergency. So we just kind of set it up that, it's the summer in Louisiana, and we're out and about. People are on jet skis, they're water skiing, they're riding their bikes, they're swimming, they're out in the sun. We just talked about heat safety with Dr. Laurent. So there's a lot of things that can happen in the summer, any time of year really. But what are some of the most traumatic injuries you see, especially this time of year?
So this time of year, of course, the children, are more out and about with their family members, and so with water safety, that's in any area of open water. So it could be river, ponds, or pools.
Okay.
And we just really want to promote safety education, swim lessons, and then with water, there has to be someone designated to protect the children and watch out for them. You cannot be distracted.
Right.
Parents cannot be distracted by phones. That is what we're seeing a lot more of. Phones or just even other children or other adults in conversation. So you cannot take your eyes off of children when you're around water. And we also have this water watcher system that we have that would allow, if you are at a pool or by a lake or river, and you're having fun with family and friends, this would help identify the person who is responsible.
So you would wear this. If you were the person who's designated, you would wear this lanyard?
Yes, ma'am.
So that you would know, people would know if someone's in trouble,
Right.
you come find me,
Yes.
right?
And you do what, you call 911.
Yeah.
That's the first thing you want to do. But so we see water injuries, water-related injuries, and also, in the rivers, there's always an accident waiting to happen when you have trees and stumps and things like that, especially in our rivers. So you have to take your time, and somebody has to really be paying attention, and to know CPR also. I feel like if you have a boat safety course, you should probably also be CPR certified, because it's going to take a little while for somebody to get to you.
Sure.
To
if you're
help
out on the river.
So that would only help, save the person. And then life vest on boats. If a child is not a real good, strong swimmer, or an adult, wear a life vest on the boat. Have them available for everyone that's going to be on your boat with you.
Okay.
And then we're seeing a lot more ATV accidents, four-wheeler accidents, golf cart accidents. It seems like everyone's on a golf cart these days. If you're not 16 with a driver's license, you should not be driving a golf cart on our roads.
Right.
And then with ATV safety, we're seeing a lot of, arm or head injuries, broken arms and head injuries. Well, head injury could be prevented pretty much with a helmet.
Yeah.
In our area, it's just not common that we're wearing helmets on four-wheelers.
Yeah.
And so we're really trying to promote that. You could save someone's life by just ensuring that they wear a helmet.
And is there some kind of, so if I say, okay, hypothetically, if I bought an ATV for my family and I had children that I thought were going to use the ATV,
Right.
what is the first thing I should do before I ever hand them the keys to that ATV?
So they should know what it means to be responsible driving it. And there are safety courses that we have. We need more of these safety courses available to our community. So we're really looking into that. But there are safety courses, and the child needs to know that it's what that means. You know, this is a tool. It's a machine, yeah, that could injure you or someone else. And there are age appropriate machines also.
So you can buy the right size.
For the child. And also, if it's a one-passenger ATV or off-road vehicle, then there should only be one person on it.
Right. So don't throw your whole gang of friends in there.
Exactly. So appropriate safety gear, appropriate safety lessons, no drinking and driving on a golf cart or a four-wheeler.
Or a boat.
Exactly. So that's common also in our area, and we're just really, from our hearts, you know, we just really want to try to prevent these injuries and people making the wrong decisions that are life-changing.
Yeah. So I want to go back to pool safety for a second because you mentioned something about being distracted and watching kids. I've read statistically that oftentimes there will be many people in an area where a drowning occurs.
Yes, ma'am.
And why is that?
I think it's because everyone's distracted and people are not paying attention. You maybe cannot see. You're not visible. The child is not visible near the water because they're blocking your view.
Right.
And
drowning doesn't always look like what we think, right?
Right. I mean, it could be in an inch or two of water. You know, also. I mean, if a child can't swim and they're face down in the water, and then if a child inhales too much water too, that could also cause lung injuries and brain damage. So we just say, you know, bright colored bathing suits also will help you see a child in the water.
Especially little ones, right?
Yes, and help you keep your eye on, you know, that red bathing suit or bright orange bathing suit.
Okay, that's a good
And
tip.
you can see them in the water a lot easier that way also.
So this Pool Safely, is there a website with resources? I think
Yes,
there is
and
one.
it's actually the poolsafely.gov website. It's really easy to find. There are tons of materials, and if you own a pool, this should probably be something that you look into, especially if you're going to have friends and family over swimming with you.
So, what we talked about a few preventative recommendations with adults and parents to lessen the possibility of a traumatic injury.
Right.
So let's just talk about day-to-day life. You know, some children are home alone, right?
Yeah.
While their parents work. So they
Right.
may be 12, 13, 14.
Right.
What are some things parents can do to prepare their children for the safest environment at home when they are not there?
Well, just like you said, I think it's a parent's responsibility to ensure that the environment is safe. If they have a locked fence around a pool, telling the child you're not allowed to go outside or swim when I'm not home. And then our parenting center offers a lot of safety courses as well, including CPR training, the babysitter's safety
Safe-sitter.
class. Yes. So those, and then our YMCA and other local places have swim lessons too. So if they were to get in that type of situation, they would know how to respond, ensuring that they know that the first thing that they need to do is also call 911.
Right.
If something is wrong. If you see something happen, you see someone in danger and it's not a normal situation, call 911 to get help.
Okay. So let's talk about out in the wild, okay? So we're on a picnic by the river with our family. We might be camping out. Everything's going great, and then suddenly it's not. So someone gets injured.
Yes, ma'am.
Maybe they got burned. Maybe they hurt their leg. Maybe they jumped into the river and they can't swim and they've been pulled out. So what is the first thing that everybody on the scene should do?
Make sure that the scene is safe first of all, like that you're not going to endanger yourself by jumping into a fire or putting yourself in an unsafe situation also.
Gotcha.
Then if you need to immediately help the person, tell someone else to call 911. Hopefully somebody else is with you. Call 911, help the person get them to safety.
Okay. So what are some things you shouldn't do if someone's badly injured, say?
If they're badly injured and you don't know if they have like a neck injury, you wouldn't want to actually move them too much. You need to make sure that you're stabilizing their neck and their head because you can paralysis can occur if the neck
Right.
is moved incorrectly.
Okay, so just if they're hurt and you don't know exactly what the injury is, but you've got them stabilized, just leave them
Right.
in the position they're in.
Right. If they're in a safe position and they're, and if you know that they inhaled water, you can turn their head to the side. If it's not something that seems like a neck injury, you would want to turn them on their side so that they can expel the water.
Right.
And then we would hope that you had BLS or CPR certification so that you could initiate CPR.
Okay, so then let's talk about when you accompany that person to where they'll be treated, say the emergency room. What is something that you need to know from the person who can tell the story?
Oh yeah, exactly what happened, what the situation was, what the scene was like, maybe how long were they gone if they were in an ATV accident. Was it an hour ago that they left home? Were they underwater for 1 minute, 10 minutes? Did you not see them? How long did you not see them? And yes, what happened, and how old they are, and then if you have a contact for them that way the family can get there also and be there with their family member.
All the important factors
Yeah.
that would surround it.
We try to remember all of those things.
So at St. Tammany Health System, we have several resources that prepare people for, preventing traumatic injuries and also what happens if you have a traumatic injury. So tell us about some of those programs.
Well, one of our most beloved programs is Stop the Bleed. Our trauma program manager loves to teach Stop the Bleed. She will go anywhere for free. It's
Great.
a free class that we provide. You can contact our hospital, and Bethany can set you up with a free class for any group in the community. If you get a group of 5 or more people together, we would love to teach Stop the Bleed.
Fantastic.
That's just how to respond if there is uncontrolled bleeding. And we're teaching in school systems as well.
Okay,
So
great.
that's, that's providing us comfort knowing that the teachers that are caring for our children in our community are learning Stop the Bleed also.
Right. And then sudden impact is
Sudden
one that
impact.
just is happening right now.
Yes. And our next class that's available to the public is July 26th. And Sudden Impact is near and dear to our hearts. It's to teach new drivers about distracted driving or driving under the influence and what that entails, the responsibility that you take on by becoming a driver and how easy accidents can happen. And we usually have speakers from family members that have lost a loved one or have suffered severe traumatic injuries. That way it's a real personal experience.
Yeah, and correct me if I'm wrong, but don't the students also visit the emergency department?
Yes.
Speak with the trauma staff?
We always we try to find a critical care patient first for them to see, and then if our ER is not inundated, we do try to take them to the ER in one of our trauma bays so that they can see firsthand what it's like.
Yeah, so it's really a hands-on experience in that you kind of get the feel, you can see the person, you can smell the smells of the hospital.
Yes.
Like, okay, this isn't
chaos.
This isn't imagined.
Right. This is organized chaos,
Right.
and it's somewhere that you don't want to be in that situation.
Yes.
We want to keep you out of the ER as much as possible. Yes.
Sudden Impact is a really good one.
Yes, ma'am.
And then we do have a trauma symposium coming up.
Yes, our trauma symposium is really focused on staff, and people that do provide emergency care, emergency responders.
Yes.
So our trauma symposium is in August.
Okay.
And we would love for anybody else in the public that's a emergency responder to come and visit us on that day.
Okay, and that information about the trauma symposium is on our Facebook page. So is there anything else you would like to add before we wrap up?
No, I mean, we just want everyone to really think about the responsibilities that, when you are a parent or a child that's a driver, this is life-changing decisions that you can make.
Sure.
And we just want everyone to take every process seriously and, wear your helmets, start your kids young, wearing helmets on four-wheelers. It's just, we need to change the way people think about
Sure.
Four-wheelers and golf carts.
Okay.
And then swimming, if you're around water, just try to be safe, really.
As possible.
Keep everybody safe. Yep.
Okay, good. And we want to remind people that St. Tammany Health System has an emergency room, our main emergency room at our main campus at 1202 South Tyler in the hospital. Within that emergency room, we have a pediatric emergency room. And then on the 3rd floor of our hospital in the new family center, we have an obstetrics emergency department with a hospitalist on staff 24/7 and OB hospitalist. And then we have our freestanding emergency room in Mandeville, 2929 Highway 190, right across from the post office. So Bethany, thank you so much for joining us. I'm sorry, Nicole.
Nicole.
I called you Bethany.
It's okay.
But I had Bethany on the brain with Stop the Bleed. But thank you so much for joining us and sharing this information with us.
Thank you for having me.
And thank you all for joining us as well. And have a safe summer. We'll see you next time.